Swadikap, good afternoon once again. Today is Friday, the 17th of September 2021, and we're back with the English language summary of the press briefing with the latest situation for today. Thank you, Dr. Pisamai, the assistant spokesperson for the Thai language edition. Towards the end of her briefing, she talked about some interesting issues. The first is about the transition to the sandbox or the pilot project in certain provinces, which you know is happening already in Phuket and in Samui and in other provinces. Now, 5 other provinces, including Bangkok, are in the pipeline to become a pilot sandbox project. But to date, at the moment, the current situation is that the current measures of quarantine still remain for those entering the country from international arrivals. That still remains until further approval or discussion. Now, for a province or a city to become a pilot project, a pilot sandbox, like Phuket province, there would have to be the process of local self-evaluation, as well as evaluation of the situation and the capacity by the central government authorities, such as the Ministry of Public Health and other authorities. So that still remains for other provinces aside from Phuket and Samui and those in the first sandbox pilot scheme. The additional provinces will keep you updated on the decision on that. There will be, of course, a general CCSA meeting in the coming weeks, which will address this issue of expansion of the sandbox scheme, which will possibly include 5 more provinces, as we mentioned, including Bangkok in the future. So I'll start off first with the vaccination progress, the numbers that we have for today. And we have a slide coming up for you that yesterday we administered quite a high number of doses. You see on screen now, over 864,000 doses of vaccines, increasing the accumulated number of vaccinations in Thailand to over 43 million doses now. The breakdown you can see there, first dose for yesterday only is over 350,000 doses. And for yesterday only, second dose at 512,000 doses for yesterday only. Now, of course, you can see that the daily number of people receiving the second dose is now greater than the number of people who have received the first dose now, which means that we are making quite satisfactory, good progress towards meeting the vaccine target. The total number of people who have received their first dose is over 28 million, and second dose over 14 million. This number also includes, of course, the expat community in Thailand. And with this vigorous vaccine drive we have been implementing, 8 provinces in Thailand have already achieved 50% target that the government has set for the month of October. Over 50% already. These provinces include Bangkok, Pathum Thani, Samut Sakhon, Samut Prakan, Chachoengsao, Chonburi, Phuket, and Phang Nga. I'd just like to add that aside from the vaccination, of course, we have the testings, the ATK and the RT-PCR testing. The ATK testing in particular, as the initial testing instrument, the ATK will be more widely distributed and disseminated across Thailand. Firstly, now they are given to those who are most at risk, those in living in congested communities. In the future, it will be more widely available through various hospitals and medical institutions across the country. And everybody will be able to access the ATKs for the initial testing of COVID. So vaccines, ATK. I'd like to move on, of course, to the vaccination, which is for a new group, which is the young children, as we mentioned in the past briefings. So as to prepare for the resumption of Thai schools in particular, in the month of November, the priority now is to get the vaccination to be allocated to young children aged between 12 and 18 years old. Particularly, this involves 4.5 million children, and it is involving the Pfizer vaccine. So in due course, the actual announcement for registration has already begun through many schools across the country, and they're in the process of registration. The inoculation appointment is expected to begin in the beginning of October, so very soon already for school children all over Thailand. Excuse me. Just to note, now what kind of schools are these? It involves the private schools, including international schools in Thailand, public school, government schools, vocational schools, schools managed by the border police. Now, if you live in Thailand, you know that in the border areas, the border police manage the various schools for people living in the border areas, the hillsides, as well as vocational schools. Also schools which are affiliated with religious studies, such as the Pana schools, which is the Islamic religious schools across Thailand, as well as schools that are affiliated with Buddhist temples or the Buddhist religious schools. So all of this will be covered for children in Thailand aged 12 to 18 in due course. I'll move on to the future procurement of vaccines and medical supplies from abroad. The Ministry of Foreign Affairs has been continuously in talks with several countries to secure a variety of vaccines and medical equipment on different platforms in all available opportunities, both in terms of purchase and also in terms of assistance, and which I'll say exchange and swaps as well. And further details, of course, for each successful negotiation or program will be that is confirmed, will be announced to the public in due course. Of course, the Ministry of Foreign Affairs is pursuing vaccine diplomacy through diplomatic channels to assist the vaccination procurement efforts of the government. And we're talking to several countries, both in terms of the price negotiation as well as the donation or assistance requests. Just one update on this is that earlier this week, the cabinet had approved the procurement of 449,500 doses of AstraZeneca vaccine from Spain. So this is a new lot of procurement of AstraZeneca from the country of Spain. And this is actually the first vaccine procurement from a European Union country. Of course, we have homegrown vaccines, as we talked about. Just to share an update with you, you may have seen in the news, the team of doctors and scientists at Chulalongkorn University have been working to develop the CoV-19 vaccine, now entering the third phase now of clinical trials, with expectations by the end of this year or early next year, we'll be producing our own doses of effective vaccines. And this could possibly make Thailand the first country in ASEAN to produce such. And as for Bayer Phytopharm, another candidate for the homegrown vaccine, the project is entering the first phase of clinical trials and now calling for volunteers for the trial of the vaccine, which is called Bayer SARS-CoV-2 Vax-1. For the general situation numbers that we have for today, new confirmed case, we have 14,555, as you see on screen now. New recoveries, a close number, is 13,691 recorded yesterday. We have the current number of active cases still being treated at 129,421 cases. The number of fatalities, very happy to announce that it's decreasing. Today it's 171. The fatality rate in Thailand still remains low comparatively to the global rate. The fatality rate in Thailand is 1.06%. I'd just like to make an important point clarifying about the color-coded zoning schemes, that the government has issued two sets of color-coding schemes that involve the spread of COVID in the country. One set is to demonstrate the areas and the infection rate per population, the infection rate vis-a-vis the population and the province, while another set of maps or visuals is to indicate the level of pandemic control requirements and the precaution guidelines. So these are the two basic types of color codes that we have come up with in our maps. And these schemes were established by the CDC to be complied by all citizens as well as health agencies in Thailand. And both sets are updated on a regular basis. So firstly, on the infection rate map or scheme, the government has established the 5-color scheme, as you know: red, orange, yellow, green, and white. And coming up, I'll have some four maps of Thailand actually, so you can see the picture. This first map, you see that the country is quite red, colored in red, demonstrating the provinces where the number of infections exceed 100 people in that particular area. So if there are 100 people infected in one province, in a particular province, the whole province would be colored red, right? And I'll move on to the other maps now. Now, if we go into more detail on the infection rate, you would see that the particular towns or districts in each province have also been put into either red or orange or yellow or green or white in terms of the number of infections. So if you go into detail, the actual district, sub-districts, village, and community level, you can see that it is more green or even white with no infection. This is increasing proportionally and exponentially when we go into detail. So can I go back to the first map just now again? So province-wise, if there's 100 infections in a particular province, that would be the whole province being red. And you go on to the second map. If we go to the district level, the red gets the visual of the red is decreasing because each province would have infections in district level or sub-district level, but not in the entire province. So that's the kind of information that we have. And we go to the next maps, we have the community level or the tambon level. You'll see less of red there. So the more detailed we go in, we know that each village has their own red situation, but it does not mean that the entire province is red. So that's just a clarification for you when you look at these types of maps. And this is the kind of detailed information that we have for you. When you see your own province being red, it doesn't mean that the whole province is infected. It might mean that one district or one village in your province has infections to the level of red or orange or yellow. Okay, so just for that clarification. Now for the second set of information or maps color scheme, that demonstrates the pandemic prevention and control measures. Of course, 5 colors there. We've seen this map before. This is actually the color scheme for the control, meaning dark red signifies the maximum and strict controlled areas with the corresponding measures in restaurants, in whatever business types or activities that we have talked about. Red, of course, maximum control. Orange, controlled area. Yellow, high surveillance. And green for surveillance. So this is a classification of the provinces and with the corresponding measures. So you know that in the dark red zones, the curfew still applies and the like. Okay, so these are 2 types of information. So currently, 29 provinces, including Bangkok, are in the dark red zone and 37 in the red zone, and no province is currently categorized in the yellow or the green zone at the moment. Yellow meaning high surveillance and green just surveillance. So this predominant color of the second set of this color scheme is red. The predominant color of the map is red due to the government's efforts to effectively control and prevent the spread of the infection. So in terms of the measures, we put a lot of provinces in dark red so as to be very strict and very sure, just to put it in simple terms. But when in truth and in fact, the red in this chart, or dark red in this chart, simply shows how serious the government is and has been in containing the spread of the pandemic. So before closing, before this briefing ends, I'd like to allow me to highlight once again that while we are now entering the downward trend, so to speak, in both the number of infections and the number of fatalities, and some businesses are reopening, we still have to continue to practice and follow the various health guidelines for our own safety as well as for our community. Now, especially for restaurants and businesses that have to work to create a COVID-free environment that we have mentioned. It'll be a challenge for them, but rest assured that the government and the CCSA will be in full support. I talked about the ATKs just now. That will be distributed more widely to restaurants that have to create such COVID-free situation as well. So best of luck to them and to all of us, of course. This is all I have for you today. Please stay safe, have a pleasant weekend, and we'll see you again on Monday. With that note, thank you. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพัฒน์